Alrighty, ladies, thank you very much for joining us today. Thank you to everybody who's able to watch the stream today. Unfortunately, we had some major technical difficulties going live this afternoon, but you are currently watching a recording of of our conversation today. So please feel free to pop all your questions and comments in the chat, and we will reconvene this live at a later stage when Meta does not stop us from doing so. Thank you very much, everybody. My name is Kashifa Ansa. I am the campaign manager for Rethink Your Drink. Rethink Your Drink is DGMT's reimagined alcohol harms reduction campaign. And our work focuses on policy advocacy and now also working on behavior change, educating and empowering South Africans to make healthier, safer choices around alcohol, including drinking socially, etc. Today is a very important conversation that is very close to everybody who is in the room today and so many of the people who started following us over the past week. Our social media has just gone live. So if you follow us, thank you very much. And if you haven't, click that follow button so you can catch up with all things alcohol harm reduction and all things Rethink Your Drink. We are right at the end of Alcohol Awareness Month and going into Child Awareness Month. And so today's conversation affects both of those factors. We're talking about fetal alcohol spectrum disorder today, and it is a very important conversation to be having because I don't think South Africans are aware of the severity of fetal alcohol spectrum disorder in our country today. We have one of the highest prevalence of fetal alcohol spectrum disorder in South Africa. Some provinces have numbers as high as 1 in 5 children living with the disorder today. And today we're joined by two amazing women in their fields today. Joining us from DGMT is Dr. Busi Kabane Bailey. Dr. Busi is the DGMT Inclusive and Innovative Society Innovation Director. And we are joined by the Director of the FARR today. Joining us is Dr. Liana Olivier. Thank you both very much for joining us and for making the time today.
Thank you. It's a pleasure and an honor to be part of this conversation.
Yes, thank you so much. It's a pleasure to be here.
Great. So thank you so much. As I mentioned earlier, we're talking about fetal alcohol spectrum disorder in South Africa is important because I feel like it's something that's very misunderstood. For starters, before entering into this work myself, I did not know that we changed from calling it fetal alcohol syndrome to fetal alcohol spectrum disorder. And so that is a very big distinction. And I'd like to start with you, Dr. Liana, today. Why have we changed the name? What exactly is FASD?
When we, thank you for asking that question right at the beginning of the conversation. When we started doing work on the harm caused by alcohol use during pregnancy, the only term that was known was fetal alcohol syndrome. And as research expanded and we gained more knowledge globally, we discovered that it's actually a spectrum of disorders. So fetal alcohol syndrome is just one of the disorders that you find on this spectrum. So one can't say, sometimes people talk about fetal alcohol syndrome or FASD as the worst case scenario, but one can't actually say that because one of the conditions is, for example, called alcohol-related birth defects. So it might be that the child is born with a heart condition or eye problems, etc., due to the prenatal alcohol exposure, or alcohol-related neurodevelopmental defects, which indicate the brain damage and so forth. So basically, FASD, an umbrella term for all of those disorders on the spectrum.
Thank you very much for clarifying that. And I mean, I think we've all heard them, and we'll speak more about the myths around alcohol consumption during pregnancy, but we've all heard, a little bit of wine is okay. I saw a gynecologist based in the US a couple of months ago post a post saying that if you're over 29 weeks, it's okay to have a little bit of champagne if you're at a wedding. Those kinds of messaging are still continue today. But recent data, and I'm sure you would know, shows that there is no amount of alcohol that is considered safe during pregnancy. Can you maybe elaborate just about what that entails, and also why is it that we have people who still consume alcohol without realizing the risk, or maybe they are aware of the risk, but still consume anyway? Maybe they think it's not enough to have any effect.
Globally, and also here in South Africa, in our studies, we've seen now on many occasions, and it's been confirmed, like I said, globally, that no amount of alcohol is safe anytime during pregnancy. And yes, we also get, especially in our private clinic, we get patients coming in with brain damage. And then the mom would say to us that the message she received from a doctor or gynecologist or healthcare practitioner is that it's okay to start using alcohol again during the last trimester. But one must remember that the brain or the central nervous system starts developing soon after conception. That's usually, sadly, the time also when most women don't even know that they are pregnant. And that's another factor. Why are women drinking during pregnancy? Basically because they didn't know that they're pregnant. And then also because they don't know about the harmful effects of alcohol on the fetus, and also not about FASD. So no time during pregnancy is safe to drink. And therefore, we always say that if you plan a pregnancy, you're not going to know exactly when you fall pregnant. It's rather better then to abstain from using any alcohol for just in case you're pregnant.
Thank you very much.
I'd like to just add to that, I think for all women of childbearing age, it's important to consider a fetal alcohol spectrum disorder. And so if you are of childbearing age, you need to make sure that if you drink alcohol, you're on a contraceptive to help prevent pregnancy. And if you're planning for a family, you need to be aware that, this is a major risk factor. And, just to go back to Dr. Liana's description of the spectrum, it manifests in such a wide way. It can manifest behaviorally for children. She mentioned the, brain damage. It can delay the milestones of, as little babies develop, they're sitting, they're crawling, they're talking, they're walking. And usually people identify it with specific facial features, but that spectrum definition shows that it's an expanded definition of the disorder.
I think, thank you very much for that, Bruce. I think it's very important to clearly define the fact that it is not limited to the physical features, because that is what we all know fetal alcohol spectrum disorder to be, right? Is the physical features. And if your child physically does not appear to have any issues due to your alcohol consumption during pregnancy, but as you mentioned earlier, Dr. Liana, the neurological effects are there. Now you've mentioned, Brucey, about being able to reach those developmental milestones. All of those things can be affected by alcohol. And because there is no amount of alcohol that is safe during pregnancy, as you said, Brucey, it's very important for us to rethink how we speak about alcohol during pregnancy as well. And it brings me to my next question, because it also ties into some work that I do myself. I am a practicing doula as well. And coming into working with Rethink Your Drink, I actually realized that I have never thought about asking my clients upon intake if they consume alcohol, or if they consumed alcohol close to when they found out they were pregnant. One just assumes that because somebody is pregnant, they would stop drinking cold turkey, or that they haven't been drinking close to the time they found out they were pregnant, and we just carry on as if nothing has happened. Can we perhaps then speak to now the kind of contributing factors to consuming alcohol just before or during pregnancy as well? Can you speak to how things like poverty, things like violence in the home, in the general community, and the lack of support contributes to something like this? Because we know that, and at least from the Rethink Your Drink perspective as well, that fetal alcohol spectrum disorder is not an isolated personal and individual experience. It is a national crisis. It is a national health crisis. And so we know that there are contributing factors to this. And can you speak to some of these, how they contribute to alcohol consumption during pregnancy, and what we can do, our systems can do, whether it's health systems, whether it's government policy work, what we can do to shift that?
I'm sure. I'll start this one off. I think you're absolutely correct, Kashfa, in saying that clinicians or the workforce that are at the interface of antenatal care often neglect to ask the question around alcohol. And it's extremely important, particularly in the South African setting. I think in the Western Cape, we have some of the highest fetal alcohol spectrum disorder rates in the world. And so it's a vital question to ask at all stages of, like I said, childbearing age women, women who are pregnant, because of the lasting impact that alcohol can have. And I think it's also important to consider our context, South Africa's history with alcohol. We have a colonial past where there was a DOP system where farm workers in the winelands were paid through alcohol, and the legacy of that DOP system lives on with the high rates of alcohol consumption that continue today. And also how alcohol consumption has sort of integrated its way into culture and cultural practices. And so we need to, accept that we live in that reality. And so it is a pertinent question for anyone working at the interface with women and pregnant women to be asking those questions around alcohol and alcohol consumption, and also to provide referral to the right channels to say, hey, if you drank previously or currently drinking, how do I stop? Where do I go to get that kind of support? I think is crucial.
I want to add, if I may, with what Buzi is saying, and also something that you mentioned, it is an overall problem. One of the myths is that it's only prevalent in certain cultural or groups or just in certain areas. Buzi did mention now the TOT system. Yes, that was one of the factors, but unfortunately, we're way past that system now. And the reality is, like we've seen in our research and that what we've done in the rest of South Africa, and we've got projects in the Western Cape, Eastern Cape, Northern Cape, and the Free State, and we've done work nationally and in Gauteng as well, is that women drink basically because they quite often find themselves in hopeless situations. Anxiety, depression, those are big problems. And then also a contributing factor is peer group pressure. So we find in our intervention programs and our awareness programs, especially where we've got community centers, the importance of getting the partner, the father of the child, the family and the friends, getting them on board also. It helps with the stigma and the blaming as well, which I'm sure we will touch on later on as well. But it is a problem that we are all facing. It doesn't matter, whether you're drinking champagne or drink from a pop suck or a plastic bottle or whatever. Alcohol is dangerous to the unborn baby. And we need to realize that. And that is one of the reasons why we're sitting with prevalence rates as high as 31%, 310 per 100,000, 28.2%. And the rest of the world globally, according to the World Health Organization, the prevalence of FASD is less than 1%. So it shows what a tremendously big problem we've got in South Africa. And for many women to get services just to stop drinking or so, it is just not available. So at antenatal clinics, you quite often find that the question is asked, do you drink during pregnancy? But there is no service available. If the woman says yes, then she gets a lecture on not to drink, and that's it. So yeah, desperation and just to cope with the day is also, are factors that we need to take into consideration.
Thank you very much for that, Dr. Liana. And I'd like to follow up because you speak now about the psychosocial support, the access to services, be it rehabilitation or simply psychological services that can be offered to women who are pregnant and need help with their consumption of alcohol. Can you speak to what the FARR has done, some of the projects and interventions that you're doing? What do those look like? And what are some of the results that you've seen?
But in our country, I think we will all agree, if you don't put stats on the table, if you can't show how big the problem is, we've learned that from the TB and HIV fields as well, the problem does not exist. So for us, it was very important to do prevalence studies. big community studies to show and to find out whether it is a problem. And that is why I could quote those figures, because we've done very clean and clear scientific research using international standards. Okay, so firstly, when we work in an area, we start by doing a prevalence study. And then doing that, we also engage with the community at large, looking at reasons why people drink, not only women, and use a look at the culture and the, alcohol behavior patterns and things like that, so that we can develop evidence-based programs that we can then implement in the area to help the community to help themselves. And then one of our evidence-based programs is, for example, our Healthy Mother, Healthy Baby program, where we enroll pregnant women as early as possible during pregnancy. Not all women participating in the programs are alcohol users. Some of them are battling with things like domestic violence, etc. And then various other programs. But our aim is to offer whole of society type of interventions, so that we can stop the finger pointing. Instead of pointing a finger, you ask yourself, where was I when this woman was pregnant, and what can I do in future? Then also we've got a training unit. So just to give you an idea, since 2017, as an example, we've trained close to 19,000 people in South Africa and close to 3,000 professionals, because the training of professionals are equally important for us, people working in the area. So actually, to use this terrible word, capacitate people to with more knowledge and skills to address the problems in an area. And it's remarkable how the prevalence rates have dropped in the areas where we've been operational for a couple of years now. So it shows you that it can be done by support, by caring, by not blaming, by being there and standing together to address this problem.
Absolutely. And I think the standing together is something that with today's conversation, we as Rethink Your Drink and DG Murray Trust as a whole would really like to start, is this idea of collaborative effort to solve these issues. As you said before, you're not exclusively focusing on just women, on just pregnant women. You're looking at it as a whole society approach. And speaking of that whole society approach, I want to link to some of the myths that we spoke about earlier again, and kind of some of the questions that we keep getting asked when we look at fetal alcohol spectrum disorder or alcohol consumption in pregnancy, or after pregnancy as well, for instance. Somebody who's found out that they're pregnant, has had alcohol before, this is both for Dr. Liana and you, Dr. Busi, as well. They've now found out that they're pregnant, but they've consumed alcohol and they know that they can stop and they want to stop. What is it that they can do? What is it that they can do? What is available for them to be able to do to ensure that they're giving their child the best start?
Busi, do you want to go first or should I go?
You can start off.
Okay. Yeah, it is an important conversation to have, because I can only assume that there might be women who are pregnant who are listening to us now and who might be very worried. And we always say it's never too late to stop drinking during pregnancy. And we don't expect you to go cold turkey. So we would like to be there to at least assist, to refer you to places or to put you in contact with people who can assist, but also start with in your own family, church or a religious group, go to the clinic, etc., etc. Look at what is available in your area. So the best thing is to keep in mind, it's never too late to stop during pregnancy. So immediately when you stop, you prevent any future damage to be caused to the unborn fetus. Also, sorry, if I can just say this, one must also remember that it's not all mothers who use alcohol during pregnancy who will have children with FASD. For some reason, sometimes there are people who are lucky. It might be that your child is going to be lesser affected, but we've had cases also where moms would say to us, with my first child, I drank a lot of alcohol. And with my second child, I just drank a little bit of alcohol, and my second child is heavily affected. So it depends from pregnancy to pregnancy as well. But the message is no alcohol during pregnancy. Sorry, Lucy, you go ahead.
No, I think absolutely correct, Dr. Liana. I think for me, I would just go back to all women of reproductive age need to think about alcohol consumption and its potential effects. And so if you're a woman of childbearing age, you definitely need to think about being on a contraceptive, because prevention is always better than cure. But specifically to your question, if a woman finds themselves pregnant and they have consumed alcohol or consuming it, I think the initial advice is to stop immediately. Dr. Liana is absolutely correct in saying it's never too late to make that stop. And that stop immediately sort of helps you in the long term. And like she was describing earlier on in the interview, is that neurological system is developed quite early in the pregnancy. And so the sooner you stop, the better. And I think, like we've alluded to earlier, that your child may not be sort of affected in terms of facial defects, but they could be affected neurologically, which could delay their learning abilities. It could affect their behavior in the future. It affects their ability to achieve their milestones. And so it really has such a huge knock-on effect in the future. And so it's really an important consideration to make. And so I would also say that most women, you will go and, report at an antenatal clinic or your doctor, and it's definitely a conversation that you should have if you are drinking or unable to stop drinking, so that I know with the limited support systems that we have in place, we can try to link you up. And there's also organizations like FAR that you could be referred to for assistance. But yeah.
Shifa, also what is important, I think, is we keep on talking about the woman, but the men, the partners are extremely important, like I've said. So I hope the men who are watching and listening to us now just think about the importance for them also to have healthy children, and how important it is to support the women in their lives to have a healthy pregnancy, and how difficult it is in the South African culture to attend events without having an alcoholic drink. We've got this very strong culture. We celebrate everything with alcohol. So be the good partner to say tonight, when we're going to hang out with whoever, with our friends or whatever, I'm going to be with you, and I'm going to also order a non-alcoholic or a cold drink and not having alcohol with you, because my child is also important to me.
Absolutely,
Yeah,
Dr.
I'll even
Liana.
take it a step further and say that it takes a village, and so, beyond even just the partners, as third people in society, friends, family, encouraging and creating that safe space to be able to stop, I think will go miles in helping to support women in able to stop. Yeah.
Yeah,
Okay.
absolutely. It's like accommodating for dietary requirements, right? When you have an event and you accommodate for the vegetarians and you accommodate for the vegans and the people who are halal and kosher, it's the same thing. If you want to make sure everybody has a good time and that everybody is comfortable and safe, accommodate for all of that. So thank you very much for those inclusions. I would just like to ask, we've spoken now about antenatal services. Dr. Liana mentioned some of the interventions that FAR holds as well. But I'd like to speak to systematic responsibility and how we shift from blame to a place where we, as a society as a whole, our systems can start taking responsibility. What is needed in our antenatal services? What is needed in education for not only expected mothers, for the community at large? What is needed from the alcohol industry as well to help alleviate some of the challenges we're having with FASD?
I think you mentioned legislation and policy and all those beautiful terms that we so desperately need. I think the three of us can have a conversation, a day-long conversation about legislation and the status of our outdated Liquor Act, and the fact that our new Liquor Act has been, I think it's taken, since 2017 about now to get it signed off and promulgated and so forth. And with that, I also want to say, even if you've got policies and whatever in place, you need society to stand together like we've discussed just now. But if we just look at the liquor industry in South Africa, which is basically self-regulated as at the moment, look, just put the TV on and count the number of adverts, alcohol adverts on national TV. It is absolutely shocking. And it's such inspirational adverts. I mean, if I want a yacht, I must just drink this drink. And so it's absolutely shocking. And it's so seldom that you see in all these adverts, you see it's not to be sold for people under the age of 18 and so forth. But you never see that alcohol is harmful for unborn babies. There might be a hint in that direction, but we need to talk about the harmful effects of alcohol on fetuses. And that we don't see. So we need to have conversations, and we need to be brutal about this. Then also, we've just hinted at it, the absolute lack of services in government. So I want to pull the government also in here, because people who are listening and watching us now, for anybody to get a diagnosis of fetal alcohol spectrum disorder, it is near impossible, because you need a medical specialist who can examine the child, because it's not only about facial features. 80% of people living with FASD have no facial features. So there are other signs also. You need a psychological test, and you need an in-depth interview with the mom. So you need those three things before you can make a diagnosis. Try to get that in public service. And then if you're lucky enough to get a diagnosis for your child, the service is there. There aren't any services. And quite often people, because of the impact on the whole of the body of the person, because we're talking about children, but it's a lifelong condition, there are multiple problems during lifetime, and our services are just not geared for that. Children living with FASD quite often drop out of school early. And that's also one of the reasons why we've got such a very high dropout rate at schools. So, and teachers are, desperate, because they don't get the necessary support and training to manage children living with FASD in the classroom. And yet we've got an inclusive education system. And then, of course, if your child drops out of school, the abuse, the exploitation, so that the people living with FASD doesn't only end up as the perpetrators, they're quite often the victims as well. And lo and behold, if a person is living beyond the age of 18 with FASD, where do you go to? Because you didn't complete your education. It's difficult to find work and to keep your work with all your challenges. So we've got a lot to do, and it's definitely the liquor industry, but government and whole of society should stand together here. But if we can just get proper alcohol legislation, that will also help.
No, I absolutely agree that, legislation changes and advocating for policy changes. I think for DGMT, we've engaged in strategic litigation at the municipal level to try and shift liquor trading hours, because, lots of municipalities are kind of in cahoots with the liquor industry to maximize profits. But, as Dr. Liana described, the harmful impact is absolutely exponential. And so you can imagine, with such high rates of FASD in South Africa, sort of that long-term lifetime impact is crucial. But I think it's also important to get the community buy-in around this issue. I think I agree that we see these sophisticated adverts about liquor consumption and how it signals, some kind of status. I think the community at large need to have a more expanded conversation of what are the harms, how many you know, the harms of alcohol in general, you know, the accidents on the roads, the physical disease that alcohol brings about, gender-based violence, and then absolutely the fetal alcohol spectrum disorder rates that are just higher than anywhere else in the world. And that you know, that really should make us sort of stop and pay attention as a country. But I also agree with you that we can only do this with collaborating together and, you know, breaking out of our silos, and amplifying this message.
Absolutely. Thank you very much. And speaking of collaborative efforts, I'd like to also share one of DGMT's initiatives in that regard, especially with regards to children, is the National Accelerator Program for Children here, hosted by DGMT, is known as Hold My Hand. And Hold My Hand really focuses on a very big collaborative effort to help support children and help children in South Africa thrive. And one of their accelerator programs focuses on alcohol use and how that affects children and young teenagers as well. So I'll leave the details of Hold My Hand in the chat. And if you or anybody that you know is looking for a place to plug in, to be able to network with other organizations, to partner with them, I think, and with regards to children, Hold My Hand is really the place to be doing that as well. But I would just like to ask now, people who are watching this, perhaps maybe are directly or indirectly affected. If I'm watching this right now and I need help right now, where can I go? Dr. Liana is far in have the capacity to be able to take responses from people right now. What can we do to help people in the immediate?
People are welcome to phone our landline. I'm going to give the number now, if I may. It's 021 686 2646. I repeat, 021 686 2646. Leave your name and telephone number and just say you want to you want to speak to me. Then we will take it from there. Or you can send an email to info@farrsa.org.za. I repeat, info@farrsa.org.za. And you can also visit our website for more information as well. So feel free to contact us.
Thank you very much. Thank you very much. I will leave that information in the chat. Dr. Busi?
So I'll say, you know, they can also go to any of the public you know, governmental clinics. They'll be able to, you know, get assessed by at least a nurse or a doctor in that system. But also with DGMT, we work with various other nonprofit partners. And so you can find us on all social media platforms. We have a website as well, and we're happy to refer you to partners like FAR for the appropriate assistance.
Thank you very much. So to learn more about the FARR, about DGMT, and also about Rethink Your Drink, you can follow us on all of our social media platforms, as Busi has mentioned. And you can also find out more about us on www.ggmt.co.za. Rethink Your Drink is certainly at the start of all of its work, and this is very, very big work to undertake. And this is definitely a very short introductory conversation, I believe, to the problems that we're facing in our country with regards to alcohol consumption. Our Bible is the World Health Organization's 5 best buys, and these are strategies recommended by the World Health Organization to the entire world on how to reduce alcohol harm in South Africa. This includes restricting advertising except at point of sale, reducing blood alcohol legal limits. It includes increasing the age from 18 to 21 years of drinking age. It includes increasing psychosocial support for rehabilitation services as well. And it also includes restricting access to liquor, which includes increasing the price of the liquor and also restricting trading times. As Busi mentioned earlier, we're involved in some strategic litigation, and currently this conversation is fueled by some of the statistics that have come out from those litigation cases as well. We're currently in process with the Northern Cape, which has the highest prevalence of fetal alcohol spectrum disorder in the country. As I mentioned earlier, 1 in 5 children living with the disorder as well. So today is just an entry-level conversation. If you have any comments or questions for for either of our panelists, please feel free to leave them in the comments below, and those will be addressed either in comments or in a follow-up live as soon as Meta stops giving us gray hair. But thank you all very much for watching us today, for engaging in this conversation. This is certainly the start of many, many more conversations related to fetal alcohol spectrum disorder or anything related to alcohol use in South Africa. We thank you very much for your time. Thank you very much.
Thank you.